The World Health Organization on June 5th changed its guidance on wearing masks in public places to curb the spread of the COVID-19 disease. The WHO now recommends wearing masks in public settings such as stores, at work, social or mass gatherings, and in closed settings such as schools or places of worship. The global body also recommends wearing masks in cramped conditions such as slums and refugee camps and on public transport. The WHO has always recommended that infected people and those caring for them wear medical masks. To prevent critical resources from being diverted from healthcare workers, the WHO recommends that members of the general public wear fabric or non-medical masks. These masks should have at least 3 layers: an absorbent inner layer, a filter, and an outer layer that does not easily absorb water. The WHO said evidence from studies in recent weeks showed masks could serve as a barrier for potentially infectious droplets. The organization had previously said there was not enough evidence to say that healthy people should wear masks. The WHO stressed that wearing masks are only one of the things you can do to prevent the spread of COVID-19. Masks on their own will not protect you from COVID-19, the WHO's Director General Tedros Adhanom Ghebreyesus told reporters at a briefing. You're probably aware and are sick of hearing about one of these things: social distancing. If you missed our video on the most important thing you can do to protect yourself against COVID-19, keep watching. Washing one's hands thoroughly with soap and water for at least 20 to 30 seconds is one of the most effective ways to eliminate the coronavirus from your skin. Here's how it works. Soap molecules have a hydrophilic head which is attracted to water and a hydrophobic tail that seeks to bond with lipids such as oils and fats. Coronaviruses are enveloped RNA viruses. Their key components are RNA, the virus's genetic material, proteins that allow the virus to infect cells, and a lipid envelope that coats the virus. This lipid membrane has 2 rings of hydrophilic heads surrounding 2 layers of hydrophobic tails. Soap molecules destabilize a coronavirus because their hydrophobic tails are attracted to lipids in the virus's lipid bilayer. The soap molecules stick to lipids in the bilayer and pry them apart, encapsulating them in bubbles called micelles that wash away in the lather. In addition to disrupting the lipid membrane of the virus, soap molecules also disrupt the bonds that hold the proteins, lipids, and viral RNA together. They effectively pull the virus apart, and the viral particles are rinsed away in water. The same process also kills other viruses coated in lipid membranes, such as viruses that cause SARS, AIDS, Ebola, hepatitis B and C, herpes, and dengue fever, as well as many types of bacteria. But remember, regular hand washing is just one of the things you need to do to prevent infection. Taiwan Centers for Disease Control recommend avoiding hospitals and clinics unless necessary, avoiding eating uncooked meat and eggs, and avoid contact with dead animals. Practice proper cough etiquette and respiratory hygiene and avoid areas affected by the virus. The U.S. Centers for Disease Control and Infection have stated that masks are not effective at preventing infection, and the World Health Organization has said that healthy people should not buy masks. But we here at Tomo News have more trust in the Taiwanese government, which so far has managed to control the virus here without resorting to lockdowns, even though we're only 80 or so miles away from China. Taiwan CDC recommends wearing a medical-grade mask to prevent the spread of the virus to people around you. Wearing a mask also helps stop you from touching your face, which is something you really need to be mindful of during the coronavirus epidemic. New research by American health officials and experts published in medRxiv shows that the novel coronavirus can survive in air particles for several hours and on some surfaces for up to 3 days. Researchers used a nebulizer machine to spread the coronavirus in the air and on several surfaces in a controlled environment. The device was used to emulate how the coronavirus would disperse if an infected individual coughed. Results showed that the virus was still detectable in the air 3 hours after it was spread. It was also detectable on copper surfaces for up to 4 hours, on cardboard surfaces for up to 24 hours, and on plastic and stainless steel surfaces for up to 2 to 3 days. An important side note is that this new evidence does not confirm that people have been infected through air particles, but that it is plausible that the virus could spread through aerosol and surface contamination. So, what can you do? Sanitize your hands regularly, don't touch your face, watch out for symptoms in yourself and others, and mainly, do not panic. That ain't going to help anyone. Writing in a study, Chinese researchers say stool tests could help to diagnose COVID-19. Health authorities might be able to detect COVID-19 spread by testing the sewers of a community for the coronavirus's RNA. Citing a new study in gastroenterology, British Columbia Centre of Disease Control told the CBC that wastewater testing could be an early warning system for community transmission. The paper offers new evidence to support the theory that bad plumbing in a housing project may have facilitated an outbreak in Hong Kong earlier this year. According to a research team from China's Guangdong province, traces of SARS-CoV-2's RNA have been found in the stool samples of hospitalized patients. The study involved 73 patients of both genders whose ages ranged from 10 months to 78 years old. Stool samples of 39 patients, or 53%, tested positive for the coronavirus RNA. Additionally, some patients started testing negative for the virus in respiratory samples, even as their stool samples continue to show positive results. Endoscopy indicated that the 17 patients, or 23% of the total, were still infected, and that they may have been able to infect others via fecal-oral transmission. For more news animations and explainers, hit the subscribe and bell button to join the Tomo News family. Thanks for watching.